And we are just so super excited today and to have our special guest. And before we usually do our check-in. I just want to check in with my colleagues. And the reason I do this every week is it's really important for us to have our listeners know us, kind of know who we are, what we're about, and also to kind of check in because we are all friends here at the New Hemp Times. And so today I just wanted to kind of check in with my compadres, and then we're going to kind of get into some fun content. So first, Jahan, how are you doing these days, Dr. J?
I'm good. I was actually mentioned in the newspaper for non-cannabis reasons in my hometown of Sacramento, California.
Really?
My old haunt when I was a kid, the comic book store closed down. And I used to do odd jobs for the guy to get get box of cards and stuff, like taught his daughter to swim and all this stuff. And he mentioned that story in the paper. He's like, there's this kid who used to come in. I thought he was really sketchy. He did all these things. And then one day he showed up and he was a doctor. And he was like, that was like his interview with the Sacramento Bee was like talking about our interactions together. And I thought that was pretty cool.
Oh, that's cool.
You were
that memorable.
That's really sweet.
I've heard the word Renaissance man being touted about Jahan so much this week that it's been kind of funny, cute, but also a little sickening. Just kidding. But he does everything, you know. You are one of the most memorable characters I've ever met.
Thank you.
Anyway. So next I'm going to kind of shift the focus to my buddy, Randy, the farmer Ran. So what have you been up to?
So missed you guys last week.
I missed you.
Yeah. We up on Cape Cod.
Yeah.
And we did a nice build up there. Massachusetts is legal, as everybody knows.
Right.
So every house can have 12 plants.
Yeah.
So Brooklyn Sprout did a little clone program that we started, and we were able to keep some moms up there, some tasty moms, in a nice little greenhouse we did at our new partner, Billy Munson. So Billy Munson should be chiming in today, and we did a great job with that project.
Oh, awesome.
That was cool.
Oh, that's cool.
Yeah.
That's cool.
Yeah.
Well, I had a really good week. I got to...
Yes, how are you doing, Jan?
I'm checking in. I just...
Jan.
Self-care. Doc Jan needs self-care too, people.
You spend so much time on us. We need to hear from you.
Oh, geez. It's been good. It's really been good. Just kind of feeling like what it's like to be in such a fun workspace, and we've grown a lot and got a new office and are just really kind of doing some fun things and meeting new great people. And one of those things is just such a pleasure to do this. But one of the reasons that I'm bringing that up is because the person we're about to talk to today, we met actually. What is it? You work with the Association of Cannabis Specialists.
Right.
What do you do for
I'm
them?
their education chair. So we put together a weekly online lecture webinar series, and Jan gave us a wonderful presentation. Thank you. Connected that way.
Thank you. I know, because we kept missing each other.
I know. We're literally
look, just I'll do it. Let me just do it. I don't have time. You're like, I don't have time. We're like, we're on it. We're good.
We got it.
And I love that was the way we started working together.
Absolutely.
It was kind of like that. But what I really liked, anyway, what I really enjoyed about you is how much you make cannabis approachable for everyone.
Yeah.
And of course, your name, and I didn't say this for our podcast listeners, is this is Stacia Woodcock.
Hey, hello.
I'm being so rude.
Welcome.
I'm leaving. That's it.
But Stacia is actually a doctor of pharmacy. Mm-hmm. And can you kind of tell us a little bit about what that does? And
yeah, so it's more of a clinical pharmacy degree.
Yeah.
It previously was a registered pharmacist. Now it's all a PharmD, doctor of pharmacy degree. So I'm a legit pharmacist. I get asked that all the time in the cannabis space. They're like, "Oh, you're a cannabis pharmacist, but are you a real one too?" I'm like, "No, yeah, I have a doctor of pharmacy degree." So in New York, we're really lucky that, or I think we're really lucky. Maybe I'm biased that way, but I think we're really fortunate that all of the dispensaries, the medical dispensaries here, are required to have a pharmacist on staff.
It's so important.
Yeah, and so that's sort of how I came into this. I lived here for a long time, moved to Massachusetts, and then when this sort of happened, I came back to New York for this opportunity to be involved and help train pharmacists clinically, so they know what they're doing, because we don't learn this in pharmacy school. We don't learn it in medical school, as you guys know. So it's a steep learning curve. So just because we have these pharmacists, they need to know what they're doing. So that's sort of where I fell into the industry, and now I'm with Curaleaf, and it's great.
And so you work with Curaleaf.
I do. I work for Curaleaf, one of the registered organizations in New York. We're a national company as well, but I focus in New York, and I do the majority of our clinical training and our practitioner outreach, because doctors have to be trained too.
Right.
And Curaleaf is, explain to me again.
Curaleaf, we're one of the registered organizations. We're one of the medical cannabis dispensary companies. We're licensed in New York and I think 14 other states right now. Yeah.
Why is it important for pharmacists to be at dispensaries?
Right. So cannabis is a medication, first and foremost. Even if you're using recreationally, most likely you're self-medicating.
I call it therapeutic
some form or
use.
another. Absolutely. But with it comes drug interactions. There are contraindications to specific disease states. And most of the patients that are coming in, especially with a medical card, they're complex medical patients with lots of other disease states, lots of other prescription medication. They don't know how to incorporate this into their regimen. And these are, they're used to like taking pills, right? They're not used to cannabis medicine. When you tell them like you have control, they're like, I'm sorry, what? That's terrifying. I don't know how to do this. And so they trust pharmacists, you know? So just telling them, I'm a pharmacist. I know what I'm talking about. This is how you do it. It establishes that trust. We're what? America's most trusted profession, I believe.
Oh, yes.
And so it just
I
gives
didn't
them,
know that.
Yeah. So
you mean you beat therapists and being,
I know.
Jeez, what does that say about my job? Holy cow.
I mean, we've been giving out free advice forever, right? Like when you go to the pharmacy, you're like, I have a cold, excuse me.
Your
Lady,
number
white
one.
jacket, what do I take? What do I take?
You're
I mean, this is our MO. This is what we're used
I'm like,
to.
I'm sorry, this is how much I charge.
Right? I don't get to do that. But by the same token, like in retail pharmacy, people are coming in and, you know, they don't want to talk to me or don't want to listen to me, or they're on like 12 drugs and then 12 more drugs for the side effects of those drugs. And in cannabis, I get to sit down and have, you know, a 30, 45-minute real conversation about what's going on with them and what they're looking for and how to taper off their meds. And it's so much more rewarding. I feel like.
Yeah. Wow. Well, first off, I'm just so grateful that you're here. I love that even though there's only one person who's female on the crew, that they let me kind of say, hey, and they're like, you know, these are important things. We do need to have all of our listeners, whether you're female or male, really kind of understand what goes on and how cannabis can be beneficial. And so when we were talking about certain topics, and I've been like, we've got to talk about women's health issues, especially like pregnancy, or what about, you know, I've had lots of gynecological problems, and we've got to kind of educate women because right now it's a war on women, I believe, just with everything going on in this country.
Yeah, it's hard not to feel that way.
Be able to have more conversations around women's health. And so these guys are like, yeah, we need to do something. And when I met you the other day at the expo, it was just like, oh my God, we have to have you in. And Jahan, who's like genius, he was so excited about you coming on too, and Randy as well.
I got really excited when I saw that endometriosis paper. It's like someone else likes cells and migration. And
I'm a complete nerd.
But it spurred a lot of us to have these questions. So I'm just going to kind of shut up and turn it over to Jahan, because he has these, you know, we have so much that we want to talk about.
I'm excited. Yeah. Let's talk about vagina.
Well, I mean, I have
Jahan,
kind of
talk about the vaginas.
We did talk about tampons a fair amount last episode, but just to start kind of generally, you know, a lot of people who are health professionals or scientists get into this kind of have an aha moment when they hear about the endocannabinoid system. And I was kind of wondering, was there a moment like that for you where you saw something or read something and you were like, I want to learn more about this? What?
Oh man, that's a tough one, because from the first, honestly, when I was first approached about working in cannabis, I was like, right, it's just a way for people to get high legally, which is what everyone thinks, you know, the uppity healthcare professional that I know everything. And so I started looking into the research, and I think one of the first papers I came across was Ethan Russo's about clinical endocannabinoid deficiency. And it talks about fibromyalgia, irritable bowel, and chronic migraine, which women like most of the time, this is
Yep.
a huge percentage of women that have these different symptomatology.
Yep.
And these are things that women have been told for years are psychosomatic, that it's in their head. And they're
Yep.
given antidepressants and they're given anti-anxiety medications.
And we know the history of that, where we used to have where women were basically seen as crazy. Hysteria is an example of that.
Absolutely.
And we tend to label women with not bipolar, but borderline personality disorder.
Mhm.
So anything that seems a little emotional or dramatic is characterized as some kind of character flaw.
Womanly female
rather
hysteria, right?
than there's a lot going on.
There is. But I mean, for me to read that there's a direct correlation with these
Yep.
and the endocannabinoids, I was like, yes,
Yep.
this is the answer we've been looking for.
Can I tell you, and I'm sorry to interrupt, but that article that you're talking about was behind my epiphany about mental health.
Oh, that's amazing.
And that's why I'm just like so geeked up right now.
Kindred.
Because
I love
I know.
it.
We knew we were.
Yes,
We knew.
absolutely.
But seriously, I read that article and it was like, oh my God, if it does all of that, because I love the mental health component of fibromyalgia
Mhm.
and the connection there. And I'm like, this could explain everything.
Is that what your
100%.
epiphany was?
Yes,
Mhm.
yes. And that's really what got me like, I'm committed to this. That was before I ever met Jahan. And so it's just been kind of this great evolution. And
Absolutely.
how cool was
I love
that
it. Thank you, Dr. Russo.
Thank you, Dr. Russo.
So the next question is, I want to jump into talking about a product or two. We see a lot of products starting to be marketed towards women's health, for obstetrics and gynecological issues, things that go in vaginas. And human beings have been doing this since ancient Egypt, right? There's recipes in
Many
old
things.
papyrus scrolls like this is, some honey, some cannabis to treat this condition or that condition. But looking at some of these products, which are essentially like vaginal suppositories, I'm seeing discussions where companies will say on their website, oh, if THC is illegal where you are and you can't get it, just use CBD. And I was wondering, what is your take? Are there, if a patient came in and wanted to use one of these products, what might you say, or what would be some guidelines, or what do you think about these products?
Yeah, so I think vaginal products are amazing. I think it's nice to see products for women's health specifically. They're few and far between, though. So I think it's important to know that you can use cannabis oils vaginally as well, as long as they're not alcohol-based or water-based. Anything that's MCT oil-based is going to be best.
MCT.
Coconut oil,
Okay.
medium chain triglyceride.
See, you guys are those chemistry
There it
nerds.
is.
I'm like, duh?
Yeah,
CT. I thought it was a rapper or something.
it does kind of sound like it, right?
Oh my God. That's
Okay.
good. What would he rap about?
Exactly. Oh my God.
I have a lube.
Well, we
He
are
is a low
talking about
boiling
vaginas
temperature.
today. Vagina.
So
It gets fun, right? So
so
the important thing to know about those is anything that is coconut oil based can interfere with latex condoms. So that's a
what
good.
do you mean
Oh,
interfere?
It can cause them to be more likely to break,
Mm.
which
Wow.
is obviously not a good thing unless you're
Wow.
trying to conceive, and then it probably is a good thing and you aren't using them anyway. But so that is an area, you should pay attention to. But when we talk about concentrations of THC and CBD, especially for women's health, one of the things that I always talk about a lot is endometriosis, because by and large, we look at THC and we think pain. We want as much THC as possible for pain relief. And endometriosis is incredibly painful with the muscle cramps and everything else that go with it. But there was a really interesting study that shows one of the issues with endometriosis is that the endometrial cells actually migrate outside of the uterus and can adhere to other organs. So that can cause exacerbations of endometriosis, make the pain a lot worse. And obviously that's a bad thing. We don't want that to happen. And the THC and CBD have different effects on that tissue migration is what we call it. So CBD helps suppress it, but THC can actually increase it and exacerbate it, which I think is not common knowledge unless you're nerds like me and Jahan, where we read.
And it's so weird because this was so weird about the endocannabinoid system is if you look at like traumatic brain injuries or heart attacks where there's a lot of inflammation, THC will actually slow the migration of certain immune cells to the site. So it's not, if you've read just because you might be familiar with, cardiology and the endocannabinoid system doesn't mean that it applies to other systems.
Exactly. So again, this is why having a cannabis clinician who either talks to you about your medication or the pharmacist in the dispensary is really important, because if you look at some of these sites, they're like, oh, you have endometriosis, high THC is for you. And actually what they recommend clinically is, and I know we do the ratios backwards in New York from everywhere else, but something that's a 1 to 3, so 3 times the amount of CBD in ratio to THC is the highest you would want to go THC wise if you have endometriosis.
Say that one more time.
Wow.
So 3 times the amount of CBD to THC.
Yep.
No more THC than that. So even like a 1-to-1 ratio, which is kind of like the baseline that we recommend for pain, is a little too much THC that can have an issue with that tissue migration.
Interesting.
And is there timing with like when pain is onset and when you need to start chilling with the THC and maybe up CBD, or will it bring pain on? Or
you mean
when you're
like, when do you use it? Like when
do you use it in
before the pain gets to a certain level?
Yeah, I mean, you
or-
want as soon as usually
as you feel it.
Yeah, as soon as you feel it, and usually like if you have endometriosis, you know when in your cycle it's bad.
Yep.
So I would recommend starting like a day before you usually start getting an exacerbation of symptoms, or as soon as you start to feel them come on. Yeah.
Mhm.
Can I ask, I want to ask another question, and this isn't really so much about endometriosis, but I'm talking about pelvic pain or, gynecological pain. Like for years, I had middle spurts. I think that's how you pronounce it, syndrome, where a painful ovulation. And I've had lots of cysts. As I've gotten older, having fibroids and just all sorts of gynecological issues. So would something that could be cannabis-based actually be helpful for those kinds of pain issues as well?
Absolutely. And keep in mind that just because we're treating like uterine or ovarian or vaginal pain doesn't mean it has to be applied to the vagina, right? You can still vaporize, use sublingual oils and things like that, and that'll give you even more prolonged relief. And you can use it preventatively, and you can also use it symptomatically.
Wait, so you're saying when you say more prolonged relief, so the products don't last as long if you use them vaginally?
If you're vaping,
Okay.
right, that's not going to last as long.
As if
Vaginal,
it's vaginal.
yeah, and vaginal is going to be more of a topical. I mean, you're going to get some absorption into the bloodstream, but not as much as if you take it sublingually or under the tongue. Yeah.
Do you avoid the first pass through the liver by applying it vaginally?
Yes, you do. Yes.
Interesting.
And what does that do to the common person? What
So
does that mean?
it's going to work faster because it gets into the bloodstream a lot faster. It doesn't have to be metabolized out into the liver. And then you're also not going to get all of that like really heavy psychoactivity like you get with edibles, because all of the THC isn't being converted into the 11. Have you guys talked about this?
Yeah. So when you take an edible, the reason it takes 2 to forever to kick in is because your liver has to turn into 11-hydroxy THC, as Stacia mentioned. So that whole thing that complication is not an issue.
Exactly.
That's crazy.
Yeah, so it works a lot faster to use it vaginally for sure.
Oh, wow. Wow.
Cool. So
Got some plans.
all right. So is there a case for using cannabis
wait.
products?
Can I ask a question, though?
Sure.
It's actually about that. So my question is, would it, because I know that there are some for rectal suppositories. So would it have that same kind of time thing?
Yeah,
too?
you see rectally
Rectal
and vaginally
or
are very
vaginally?
similar.
Okay,
Yeah.
that was all I wanted clarification on, because I know that not all of our listeners have vaginas.
Yes, men can use it rectally.
Yes, for pain.
Exactly.
And it's great for people who can't hold down or can't inhale
Absolutely.
or, hold down their food. And so, I think it's beautiful that people can do that.
Are we streamed in the state prisons, by any chance?
Oh my God.
Oh my God.
Okay.
Well, to follow up on Randy and Jan's comment, I have read that the bioavailability isn't terrific rectally with some of these products, and that sometimes it has to be derivatized, or the carrier oil matters a lot more depending on.
I think that's very true. The carrier oil does seem to have a lot of variability rectally, and I would assume it would be the same thing vaginally, just because you have to pass that mucosal layer.
Mm.
So that's why, I mean, you wouldn't want to use something alcohol-based, probably would absorb better, but that's going to burn like the dickens.
I've
So we
read
don't
about
recommend that.
Oh my God.
I've read about alcohol absorption rectally. It seems to come up every now and then.
Oh my God.
Well,
They
isn't
used
that
to
a thing
have
now?
alcohol tampons.
Yeah, that's
Yeah.
exactly what I was going to say.
Yeah.
That's like a new thing. It's
Isn't
crazy.
it nuts? It's like, yeah.
So when people use either vaginal or rectal suppository, is this something you want to like use and then like go jogging or like sailing or something? Or do you want to like take some time to chill out and lay down? Is sitting okay using these? Like,
Yeah, I mean, I would say they're all going to be some sort of like fatty base that's basically going to leak out. That's not pleasant. So we always recommend a panty liner, lying down, sitting. I would not go jogging. Probably.
2 pairs of shorts.
I mean, you could, but
well, there is medication that says like, you know, causes loose stools, wear brown pants the first day you take it.
Oh my
You
God.
started yourself.
Yeah.
Shattered.
Started. Sorry.
So sticking with this theme of, but so other issues like reoccurring infections like yeast and BV, is there a case for cannabis being used to help treat these things?
not that I know of.
Really?
An
You
area
might know
for more
different. Yeah,
research.
I mean,
No,
especially
this
with
is-
like the MRSA activity, I'd be interested to see the antifungal activity of CBD. Could be interesting.
All right, that's another product
we
idea.
need to add that to the list.
Yeah.
And whoever's keeping the list, that's going to make all of us millionaires or billionaires. Be sure to put that list together.
So that's interesting. That definitely is an area for more research.
I have a question. So, what about, some women hit a certain age in their life and they start to notice changes. I don't know who. I have a friend, and my friend might be, up there in years and maybe going through some symptoms, maybe hormonally related. And is there a possibility that there, with the ECS, that there could be some kind of way that cannabis could influence menopause?
The answer is yes, which is super exciting for me to read about. So in several different ways. So estrogen is really closely linked to the endocannabinoid system. So it makes sense that when you're undergoing menopause and your estrogen levels drop, that you're going to start to get a lot of these symptoms, right? Because they kind of work hand in hand. Specifically, like specific symptoms of menopause, I know THC has been associated with a drop in body temperature. Right. So they're looking into using it for hot flashes. Because it can help decrease that body temperature increase, which is crazy.
I've started using a little bit more than I used to, and I've noticed that I don't have the symptoms that I had a few years ago.
Yeah, it's crazy.
It is crazy. Like, I haven't had like really bad hot flashes. I've had a few, but not like they used to be. And I don't know. It's
And
like
then,
I've heard stories, and I'm not going through anything that my sister went through
woo-woo.
or my mom. And
I mean, I think other than hormones, which aren't safe for a lot a women to take, right? And then soy, which we know has its own issues as well. I mean, cannabinoids make sense to me. They help with osteoporosis. They help with the anxiety and depression and mood swings that come along with menopausal hormonal
Mood
fluctuations.
regulation.
Insomnia is a huge issue, which we all know or should know that THC can be really beneficial for.
And women, for you guys, you might not realize this, but as we get older, it's really hard to sleep. I don't sleep like I used to. I wake up more frequently. I'm a much lighter sleeper. I have struggles with sleeping. And so that has been like a lifesaver for me to find a variety that would be able to help me, to have that. Because every morning I wake up, I feel so refreshed. I'm like, okay, new day.
Then, I mean, I feel like one of the biggest symptoms, and this is one that people don't talk about nearly as much, as vaginal dryness and lower sex drive, right? So use a cannabis lube, right? 30 minutes before. It's going to increase your sex drive. It's going to be a lubrication. So it's like a twofer.
Right.
It's like a win-win.
Right. Because that's for women who get older, their vaginal walls actually thin, and it leads to painful intercourse. So if you could think of, if you've been with someone of a certain age, that's kind of some of the issues that women experience a lot of. So it's also then impacts you, it conditions you not to want to have sex.
Exactly.
Because
and then
it's
it starts
painful.
that cycle.
And so THC an increasing sex drive? Is it because it's sort of replacing endocannabinoids levels that kind of change throughout life?
Yeah, well, so there's two ways it works. The first is in the menstrual cycle for women, and this is non-menopausal women, obviously, who are having a normal menstrual cycle. Your estrogen levels drop right after ovulation, and that also is like mirrored by a drop in your anandamide levels. So your natural endocannabinoid levels drop at exactly the same time. And so it makes sense that right after that is when we start to get cranky. We don't feel great. We get all bloated and just don't feel quite right because our systems are completely out of whack. And so we can kind of get those endocannabinoid levels back up with phytocannabinoids, and it resolves a lot of the not just the cramps, right? Not just the physical symptoms, but the PMDD, the dysphoria, the irritation, depression.
So how do you get to the point where we have women that have been using and have gone through menopause and may not have kind of captured all the techniques or their private usages to manage their own pain, but it's clearly worked over the years.
Right.
And we're at this point where it either needs to be shared or these new smokers, new folks who are figuring out that it does work.
Has some help. Yeah, it does.
How does it go from, home remedies to this is a regular practice or this is the best practice?
Well,
what are some
to
hurdles to that?
I think Randy brings up an interesting point, and it's exactly, that was going to be my answer, Stacia, is that this is why for me, in my position on the podcast, but also as a clinician, I have an ethical obligation to try to help people who don't have power. And I am from a state that I refuse to call it by its name right now. It begins with A and it ends with A.
Alaska.
Other than Alaska. But it's in the deep South, and I feel like there's this huge war on women. And so right now I feel so emboldened by my, I don't know if we want to call it menopausal state that I'm in, that I feel so emboldened that I feel like we need to be talking about this shit. And that's why I love that we have now experts who can speak to this, about this medicine that can be so helpful for women.
Yeah, I would love to see more women advocate for themselves. I mean, I think I had mentioned this story to you guys, but we did a women's health panel, and we were like 30 minutes in and no one had said the word vagina. And I'm just like, this is ridiculous, y'all. Like, we're all women. We're talking about women's health and we're terrified to talk about what's actually going on. And that happens a lot with women. We don't talk about miscarriage. We don't talk about anything like that.
I used to teach human sexuality, and it was so funny because they had no clue, my students had no clue, like how empowering aging was as a female, because they had bought in, like I had, all into these cultural stereotypes that really weren't true. And just like seeing kind of women change. And I remember having conversations about sexuality and how, like, when you hit your late 30s, early 40s, that's really where women often feel more empowered sexually and feel more emboldened and free. And that leads to multiple orgasms. It leads to a whole different kind of level of sexuality that you didn't have before or didn't have that confidence for. And they were so like, no, you're an old woman, And so for me, it's very important for us to kind of like educate.
Absolutely. And I mean, using cannabis can get you there sooner, right? It takes down those anxiety barriers that you have, that fear.
The physical barriers.
Yeah. And so you feel, I mean, so much, and there's so much conversation around women and sexuality, and so much of it is in our brains. We're worried about what we look like. We're worried about, do they like me? And we're worried about, this and that. And to have some cannabis on board, not only if you have pain barriers, but those psychological barriers, it just lets you be free and own your womanhood.
I feel like it actually led to a lot of transformation for myself, and even coming out as, yes, I do use, I'm very responsible, I pay bills, I'm good. And I really feel like it's emboldened me to kind of just feel better. you know, and
Absolutely.
develop that confidence.
Yeah, but then I feel like too, especially like look at New York, our qualifying conditions,
Mhm.
right? The biggest one is chronic pain. I have to explain to women that menstrual cramps are chronic pain, and they're like, "What?" I'm like, every month,
Right.
every month that
Right.
counts as chronic, and so you have to educate because they don't know. They
Right.
don't know that they qualify, and or if like painful intercourse, like, well, I'm not on the list. I'm like, that's chronic pain. You know what I mean? So it's not just about the stigma. It's about, you know, having conversations about what your symptoms are and how cannabis can help.
So chronic pain is a symptom of PMS, and right, and so, but has that been investigated as a whole with cannabis research? Has research shown some benefits, like in, I don't know, how long it lasts or the intensity or anything like that?
You mean as far as using cannabis for menstrual
Yeah.
cramps? Yeah, I mean, there has been good research that show really positive outcomes for treating and preventing, you know, really horrific menstrual cramps. And then just anecdotally in the dispensaries, I see it every day that patients who previously like were in bed and calling out sick, which is a huge issue. Like there's a lot of work days lost for women that have menstrual cramps. So having something that gets you out of bed and to work makes a huge difference.
Cannabis is good for the economy, not
There it
just
is.
because
There
of
you
the
go.
taxes. More people working and showing
Right.
up for work, and that's
100%.
actually, that helps to destigmatize it a little bit too, because you might have a stereotype, oh, a person's going to use cannabis, they're not going to show up to work. Here's
No.
a example.
Exact opposite. And women should know that their uterus has more endocannabinoid receptors than any other organ.
Then the brain.
Really?
Hey.
Yeah. The
Wait.
uterus.
In what
I
animal?
don't have my uterus.
I'm sorry.
Oh, fuck. What does that mean?
He's going to have to work harder.
Really?
We gotta
No,
smoke
serious.
more.
That's
but
actually
yeah.
a legitimate question. What would that mean then?
I mean, you're also not
How
getting,
would that affect the ECS?
you're not getting any symptomatology though either, right?
Oh,
So-
absolutely. I feel free as a bird.
There you go.
But you know, that's
Good
not
trade-off.
that's not that surprising,
Shoot.
because the cannabinoid receptors are the most abundant receptor in the brain, even if you talk about dopamine and serotonin, and how important it is for, or it, just like its role in pregnancy development and those sorts of things, it actually kind of makes sense.
Yeah, no, absolutely. And the endocannabinoid system does play a role in pregnancy, just like there's a drop in endocannabinoids before you menstruate. There's a drop before implantation. And so for successful implantation to occur, you need low levels of endocannabinoids. Your uterine lining actually forms these little pockets of low receptor activity where implantation can occur. And so if your levels are too high, you could really interfere with implantation, which is important to know for those folks trying to get pregnant out there.
So it's
Wow.
like THCV, which has been purported to be an antagonist, and CBD, which is a kind of an antagonist, you know, at the receptor. These could potentially be okay to use and not interfere with implantation.
Right, if you have
potentially.
those themselves. It's
Yeah.
anything with some THC in it that could be a potential
Interesting.
issue.
Wow.
But then
Wow.
there's a really interesting study that kind of puts that into perspective. And I think I was a fertility specialty pharmacist for several years.
Oh my God.
Which I don't think we talked about.
No.
But so when people are trying to get pregnant, they will do just about anything. So if you read something that's like cannabis might help, they're like, I'm going to smoke every day. So I think it's really important to like understand that it might interfere. But if we look bigger picture, right, there was a really interesting study and they followed couples. Like half the couples did not consume and the other half did consume cannabis, and what they found was that the time to pregnancy came out to be the same. And they're like, that doesn't make sense, because we know that cannabis can affect implantation. So they expected the cannabis group to come out lower, and what they saw was that the cannabis group was having way more sex.
I figured. They were horny all the time.
Exactly. And so it's really interesting to look at the big picture, right? If you're one of those couples that like you're so stressed out by trying to get pregnant that you just don't want to even look at each other, you're like, I can't, this is work, I cannot do this. Then if cannabis facilitates more intercourse, then that's great, you know. But if you know that implantation is your issue, which they can drill down now and they know, you probably want to avoid consuming to sort of increase your chances. So it's very nuanced. You have to look at all the different angles.
Wow. I feel like we're educating you guys.
Definitely.
or are we
No,
just
I'm-
boring you?
No, I'm taking mental notes.
Yeah. So
I love that look on your face right there, Randy. That was funny.
are there significant hurdles to either developing more products for women or just studying women's health issues? Because you sent along a very interesting paper before the show about biases in biomedical research, where it's definitely favored towards looking for treatments for straight white males, not so much minorities or women. Even in animal studies, they use male rats, male
5
mice.
to 1 is the ratio, which is just crazy town. And when it comes to cannabis too, so because of that connection with estrogen, women are innately more sensitive to THC. So whenever your estrogen levels are high, THC you're going to be way more sensitive to. So it's really interesting, and especially with cannabis, we need more gender-based studies. I mean, in the industry in general, because our biochemistry is just so different.
I mean, this is a lot of information. I used to hear from old West Indian women that were doing these practices for years. It's just that, you know, people, they were in a segment where the knowledge didn't get shared past their own community. And you're
right. I think every ancient culture that I've come acrots, women were using it for menstrual cramps, for for labor and delivery. It helps increase, it helps prevent early contractions, and then later in delivery, it helps increase the force of contractions.
Well, can I ask you about pregnancy then?
Yeah.
Is it safe to use cannabis or not if you're pregnant? Because I have to tell you, it freaks me out. You know, it worries me because as someone who teaches human development at NYU, I think about, like, it makes me nervous because we know that anything out, you know, that's exogenous could actually impact the fetal development.
Yeah, 100%. So I think that there's been a lot of free-flowing cannabis in pregnancy is great conversation. And I always dial back and I look at it from a pharmaceutical perspective because I'm a pharmacist. I guess that makes sense. But I equate cannabis the same way that I look at antidepressants or antipsychotics or anti-seizure medications. And so first of all, we don't study medication in pregnant women. That's a bad idea. So just so everyone is aware, that's not done. So what usually happens is we look back at mothers who admit to using certain things, and that's how they sort of figure out how to classify pregnancy categories. And then they'll also do animal studies to show if they show birth defect issues in animals. And so each drug gets a class of risk in pregnancy, right? So when we talk about medications, it's always a risk versus benefit. So the risk to the mother versus the benefit, the risk to the baby versus the benefit. So if you have a mother who is on an antidepressant and has like an anxiety panic disorder, right? And you take her off that medication and she starts having panic attacks, that's going to decrease oxygen to the baby. That's going to put the mother at risk. We don't want that. Right. So we'd probably keep her on the medication. We'd choose the safest one within that class, but we keep her on that medication. Now, if we have someone that like takes Xanax before they fly, and they're pregnant, we're going to tell them to suck it up, right? It's because it's not worth the risk. The benefit is not worth the risk. So I look at cannabis exactly the same way. If I have a mother who has hyperemesis, who's vomiting to the point that she has to be in the hospital on an IV, let's use some cannabis and see if we can get her out of the hospital and back functioning, right? If I have a mom who has regular morning sickness, not so much. And then we're always going to err higher on the side of CBD, the lowest THC we can to minimize the risk. But it's not a free-for-all, safe-for-all. It's not been shown to be teratogenic, so that means there hasn't been any birth defects shown.
Not like thalidomide or some of the other drugs that people, I've heard doctors compare cannabis and pregnancy to thalidomide. So I was
And the other, I mean, interestingly, there are a lot of studies on this, and initially they were showing a lot of low birth weight and low head circumference, which are just like poor outcomes for babies. Right. And then these researchers went back and looked at all those studies again and adjusted for tobacco smoke, because a lot of these mothers that were consuming cannabis were also smoking cigarettes. And we know that tobacco smoke causes those two things. Babies. So when they took that out, no adverse outcomes from cannabis.
So babies with small heads were born from that outcome?
It was because of the nicotine or the tobacco. The tobacco.
So that's the thing. They were trying to say it was the cannabis. But when they went back and they were like, actually, they were smoking cigarettes. Let's remove that data. Everything came out fine in the cannabis infants. So
it was tobacco, not cannabis.
Yeah. So what we don't know is later in life the outcomes for those kids. And there have been studies in Jamaica that have shown the children actually came out with better outcomes, and there have been studies that show the exact opposite. But the answer is we don't really know. So we want to minimize the risk.
Yeah.
That's my take.
So if my mother had not used cannabis with me when I was in the womb, might I have earned like another PhD? Is that?
I mean, it's possible. Clearly you're deficient. So
Oh my God. I can't even imagine what that would be like. Woo. Oh, Randy.
Blame it on Ma.
Yeah.
It's always the mom's
Yeah.
fault. I'm a therapist. I should know.
And I think, you bring up a beautiful point about tobacco. And this is a problem with European research, especially research coming out of New Zealand, because when you read, people were smoking joints and had this outcome, a joint over there is tobacco with a little bit of cannabis. And so you always have to think about cultural use, cultural aspects, and those confounding factors. And I generally think about cannabis, as a factor in everything, whether we're talking about development or psychosis. It's probably not at the root cause of a lot of, nefarious outcomes.
Right.
But it is a factor, and it is an interesting factor. And we don't have, the way I like to look at it is we can't predict what will happen if someone uses cannabis during pregnancy. Because there's like a certain, in breast milk, there's a ton of endocannabinoids.
Oh, absolutely.
And they have the same, pharmacologically speaking, looking at on paper, they have the same activities as THC to stimulate hunger and these other things. Does the body know the difference at the GPCR, at the receptor level? But obviously, would you say that when you talk about THC in pregnancy, there obviously are some risks, but I feel that the greatest risk is still contaminants that might be in those products. Like if you're going to use cannabis during pregnancy, at least don't go get stuff at an illegal dispensary that might, you don't know where it came from. You don't know what's in it.
Right.
I mean, that's one of my biggest arguments. And obviously I'm in a medical cannabis program here, but on the illicit market, it can be laced with whatever, have pesticides, molds, and if you're immunocompromised, if you're a cancer patient,
And
this is dangerous.
This is the hard part. So I had a medical license in Delaware and they sold flour. And that to me was so helpful because that's the way I wanted to vaporize. And that's one of the reasons I've really struggled with coming to the New York program because they don't offer that.
Right, because they're terrified people are going to smoke and smoking's bad for you.
Okay, and I get that, but
in surgery, only inhaled products are delivered. So when people say there are no inhaled medicines, it's actually majority of medicines in clinical settings are delivered through inhalation. I was like, my mind was blown when I heard that.
And the bioavailability is so much greater.
I think it's cool, though, if a couple can be a disciplined couple, like you need to be in life at times.
Absolutely.
And, hey, husband stops when the wife stops and both of you go through that challenge together. Also appreciate what it's like when you're not. So when you go back after that little crying toddler is, keeping you up, you're like, wow, it's stages of life. You can't drink all the time. There's times you've got to.
Yeah, I get it. Yeah.
So, Stacia, you've done Dr. Oz. You've been on Rachael Ray. You've been doing a ton of talks. What, two-part question. One is, what are some of your takeaway messages from those appearances? Because people might go up and throw you into a search browser and pull up these things.
So those were not cannabis related.
Okay.
I wish they had been.
Yeah.
And obviously there's a lot of stigma associated with that as well. So it's kind of interesting to see what they will and won't
talk about.
Discuss.
Right.
Yeah.
What is medicine and what is not.
Exactly. I mean, for me, the takeaway though is always accessibility of information, right? And really clear understanding, because I feel like in medicine especially, people feel like doctors don't have the time for them anymore, and they go on Google to get their information, which is like
Dr.
always
Google.
The worst idea ever.
Right.
And so it's kind of cool for in the cannabis space that we have like experts that know what they're talking about, and we take the time with our patients to like, talk about all this stuff. But just accessible, good information, which you guys are providing, is awesome.
Oh, thank you. Well, that was why we started this. We felt like we needed to really debunk the bullshit out there, because I see it on both sides.
Absolutely.
And we needed some, I don't think that cannabis is the panacea, but I think there's definitely a role, and we want to teach people how to use things responsibly, how to be healthy, and let this medicine actually lead to vitality rather than harm, you know what I mean? And so I appreciate you coming here today.
Thank you.
Sharing your information with us.
Absolutely. And we did have just a few more questions, and we can keep asking as long as we want. We got the studio time for another hour. But how have your talks been received about cannabis and women's health? Were you ever like standing ovation or booed off stage, people throw in cabbage and stuff? Or like, I mean, is it a mixed bag?
Yeah, I mean, I feel like when I first started doing this, there was a lot of like, oh my God, she just said cannabis, like in the room. And you ask.
When was that?
I mean, this was like maybe a year ago, not even quite a year ago.
So you haven't been doing this for a long time.
No, not super long.
Rising rock star.
Yes. So even just in that amount of time,
Yeah.
I mean, like I would go into a doctor's office, like even an OBGYN, and they're like, get out of here. Like, no, we want no part of this. And then at the expo we were at a couple of weeks ago, I had 3 OBGYNs with me who wanted to learn more and get certified and use it in their practice. And so just that has changed dramatically. But at the panel I was talking about earlier where no one said the word vagina, once I finally did, and I started talking about painful intercourse, and there's a couple of syndromes called vulvodynia and vaginismus that people don't talk about, but it's really painful intercourse,
so
muscle
prevalent.
spasming, and
Prevalent.
like horrible nerve pain of the labia. And so I talked about it and how cannabis could help. And I see this woman in the audience and her eyes are just like huge. And I'm like, what is going on? And she came up to me afterwards and she's crying and she's like, I never knew that I could use this. She's like, I came with my friend who has endometriosis and she wanted to hear about it. I never thought this would apply to me. And she's like, I can't even get my pap smear without like horrific pain.
Yeah. Or even if they can get a pap smear, because if you have the muscle contraction,
they can't even do it.
Put the speculum in.
Exactly. And she was just like, I had no idea. Like, I think you might have just changed my life. And I'm like, here's my email address. I will send you the name of a doctor. Like, we'll get you going. And I think 3 months later, she emailed me and she had her husband email me and he was like, you have changed our relationship. You have changed our life. Yeah. But I mean, like, that's why we do this, right?
That's
like,
beautiful.
Yeah, it was one of those great moments as a clinician that I'm just like, I've made a difference. This is awesome.
Well, that's when we do the things
All right, we
that
need to
do,
hear
right?
one. That's beautiful. One more special story, because that's stuff that people like
They
just
need to
run
hear.
with. So let's hear
Yeah.
one more special story about a patient who's had their life heavily impacted.
One more?
Yeah, can you give us one more special?
I have to do another one?
Yeah. Come on now.
Let me think. Let me try and pick a good one.
It was a good question, Randy.
Yeah. So how about I'm trying to think something that's not sex related, right? Because that's where I keep going back to, because these are the patients that are like the happiest about cannabis.
We like happy people. So.
And sex is normal. We don't talk about sex. It's been like a dirty word. And it's a very normal thing.
Yeah.
We need to normalize
so
sexuality.
I did actually have a pregnant patient in our dispensary, our Long Island dispensary. And obviously HIPAA, I'm not going to say her name, but she was terrified. She had hyperemesis, so she was throwing up constantly. That situation I was talking about.
And that's what Amy Schumer had.
Exactly.
Yeah.
I think she used CBD too. I think she said that's the only thing that helped her. But she was in the hospital and she had 2 other kids to take care of. And so she was just looking for something else. And she had gone to a doctor who was like, absolutely not. And so we have a practitioner out on Long Island who's a pediatrician. And she also helps pregnant women because she knows what she's doing. And we had a long conversation. She looped us into the conversation and we got her on a high CBD product, and it treated her hyperemesis. She was fine. She was able to go back to work and live her life. And it was just one of those situations where the value, I mean, obviously the value is in helping the patient, as it always is, but there was, it was a value in knocking down some barriers, right? Because her doctors were like, sorry, like this is it. This is the only option. And I'm proud of her for advocating for herself and being like, no, this is not the only option. I know what the other option is, and I'm going to bust my butt until I can get that answer. And so I was just really proud of her as a proud woman advocate, that, she found the help that she needed.
Wow.
Second, third, fourth opinions.
Exactly.
Don't just
don't just say no. And come to the people that know, like go to a cannabis specialist, go to a dispensary and talk to the staff or the pharmacist there.
Call
although
into our
we
New
should-
Hemp Times.
we should talk about
Call into our New Hemp Times.
yes, call into New Hemp
podcast.
Times. Can we chat about your pregnancy study that we read beforehand?
Oh yeah, please.
Because I love this.
So there was an interesting study published, and I want to get the title right here, but basically it was about what people are saying in dispensaries to pregnant women. And I also found one that analyzed Twitter comments about cannabis, which is surprising because it was, all over the place. Let's see. But yeah, go ahead. Start off.
Yeah.
Study.
So what they did, I believe it was in
recommendations from cannabis dispensaries about first trimester cannabis use, published in Obstetrics.
And it was in Colorado, if I'm not mistaken. Yeah. So they basically had people pretend to be patients, and they called dispensaries and said, "I'm pregnant. Can I use medical cannabis?" Right. And so they had a few questions after that, like, "Will I have a medical card? What about that? Oh, well, should I talk to my doctor?" Like, if they weren't prompted to talk to a doctor, they would prompt them, like, "Should I talk to my doctor?" And I thought the results were really interesting, actually, that more of the medical dispensaries were recommending it than the recreational, which is not what I would have thought. Like, I would have thought the medical would be more cautious, but like, it's great. But at the bottom of the article, they actually write out the actual word for word statements that the representatives in the dispensary made. And one of my favorite ones is, "Well, we know aspirin is safe for babies, and THC works just like aspirin, so it's probably fine." And now, just so everyone knows, aspirin is not safe for babies.
Oh my gosh. So
That's crazy.
oh my God, I forgot about this. Yeah, people would call in, like, "I'm calling because I'm 8 weeks pregnant and nauseated. Are there products that are recommended for morning sickness?" And one of the responses is, "Let me call my daughter. She just had a baby. Call me back in 5 minutes."
I mean,
No.
Wow.
No.
Some of them are like, "Have you talked to your doctor? I don't want to recommend anything. I know what would help with nausea, but I do not think I can legally recommend anything for you." So there were some, balanced stuff, but
I mean, someone's like, "Look it up online and then call me back." But
Right.
we have
Don't get me
CBD and weed in
fired.
stock. So once you figure it out by Google, you're good.
and
It's funny, but it's so scary.
The doctor will probably just tell you that marijuana is bad for kids and will just push pills on you. Maybe you have a progressive doctor that will not lie to you. All the studies done back in are just propaganda. I'm just like,
and I think
sounds like it read
so.
my
This
article.
is from
Right.
400 dispensaries, and this gets back to training of dispensary staff. I've seen similar things, and I do Secret Santa shopping when I used to do cannabis compliance assessments. I'd be like, "Tell me about this product." And I remember there's one guy I wanted to just do like the Bart Simpson, strangle him, because he's like, "This has the CBDs in it. That's the cancer curing part of the plant."
Wow.
oh,
I was like,
when
"Can I-"
was this?
Because a couple of years ago, I was like, "Can I see your training records?"
Right,
But I think
dude.
that gets back to, do you think it's just, it's very empowering to work in medical cannabis. You get to see people, it's a lot of them getting a dramatic improvement in their life, and they come back. And I've worked at dispensaries too, and, seen people for weeks and weeks and weeks coming back. But even 10 years ago, we were still very cautious about giving any sort of recommendations because we were trained not to be doctors.
yeah.
And do you think it's training that these people need, or
100%? I think it's absolutely training. And then I would love to see more medical staff oversight of a lot of these dispensaries. Like, we're lucky in New York.
You're so lucky because so many states don't have this.
Mhm.
I had a client, I think, you were in the training, or you were in that forum where I was speaking here in New York. And I can't believe that she was taking Klonopin with cannabis, and because I have this issue with benzos anyway, and I was
With
just
what?
with benzodiazepines,
Oh, okay.
that type of medication,
Yeah.
and it just blows me away. And this is in a state where they don't have pharmacists there, where they
Mhm.
don't have people who are really specially trained, and it's someone with a high school degree, and God bless them. I'm not trying to throw shade or anything, but it's just not the same level
It's
of
not-
knowledge.
and some of them know more than me. Like, I agree, but they're well trained. They've done their research. You have to read articles, and not even just read them, understand them. Like, it's not an easy thing to pick apart a clinical study to get out the nuances. I'm sure if the average person read the endometriosis article we were talking about
Right.
with G protein receptors, that
Right.
they'd be like, whatever, you know what I mean?
Right,
So
right.
it's very nuanced, and it's it kind of works against us a little bit, this whole like cannabis cures everything,
Right.
because
It does.
people,
Well,
yeah.
You overexploit anything, it's going to eventually work against you.
Right,
You know, you're
exactly.
gonna-
No, that is very true. And I just want to ask you something, because it comes up to a pregnancy and cannabis thing. I just read another one of these statements that talks about edibles. You know, start with a low dose, see how that works for you, because it would not cross the brain barrier. So if you've got the CBDs in there, it won't get near your baby. You know, it won't get in, it won't cross the placenta or things like that. And I thought that all cannabinoids kind of did.
Yeah, all cannabinoids cross the placenta and go into breast milk. So that is an incorrect statement.
So it just didn't even get close.
Right.
With the CBDs and the whatever he said.
I'm,
But
I'm
yeah,
more, I'm more worried about the mom that's going to believe that idiot that told her that.
I mean,
I know they're out there,
Yeah.
you know, but
Yeah.
there's
And you bring up
seriously.
a great point, because what you're alluding to is, in this thing, they also talk about in the state of Colorado, you are protected. So it's not something, that you have to worry about. They're not going to call CPS like they would have
Exactly.
10 years ago. And that's totally not
Exactly.
true.
no, it's not true. I mean, there have been multiple cases, and this is where, like, I've trained my pharmacists also to be really careful, because there was some messaging we were talking about, like, how do we handle this whole pregnancy thing? Like, do we talk to the doctor who certified them, or do we talk to their OB? And it's like, well, I don't want to tell them you have to discuss this with your OB, because there have been cases where the OB reported the mother and Child Protective Services showed up at the birth to take the baby away because the mother admitted she was using cannabis. And that's awful. I mean, first of all, it's ridiculous. It shouldn't happen, but it does happen. So we need to really sit down with our patients and educate them, but not put them in a precarious position where we're pushing them to talk to a medical professional that maybe is going to work against them in the long term.
Right.
So
And if you test positive for THC after giving birth, they might call CPS then too.
Yep.
I read a very alarming report a couple years ago about Johnson & Johnson had a baby soap that would trigger false positives for THC.
oh wow.
So they would wash the baby in the baby soap afterwards and then test what had
my
run off the
God.
baby, blood and other stuff. And they were getting this one hospital in Maryland was like everyone was failing for THC. And it's not like they trigger an audit like, 50% of people giving birth tested positive. We're going to see what's going on here. No, it just kept going. And so this caused a bit of a fiasco, as you might imagine.
Wow.
So in addition to whether or not we should be calling CPS over cannabis use, there's just the simple technological thing of, do the tests work and are they accurate? And what do they say about recent use or things like that? Wow. Are there cannabis and women health research projects that you're working on that you can talk about?
Not currently, but I would love to start one.
Oh,
so
yeah?
if anyone's interested, I mean,
Right here.
yes,
Yeah, we
please. I mean, we have the patients at our fingertips, so we can't necessarily do like placebo control, but we can do lots of observational research, and I would love to get on that. I think it's needed for sure.
Well, we like to work with people.
Yeah.
Like
Let's make it happen.
You know, because it's we really have this passion for trying to change the world. Trying to change the communication, the conversation around cannabis, and debunking myths, but also really presenting opportunities.
Yeah, absolutely.
And speaking of debunking myths, we're going to take a short intermission in a second. Is there anything else you'd like to say regarding the future of cannabis before we take a short intermission and come back with our cannabis thing segment?
Exciting. I'm just basically that I'm just like, I feel like we've hit the tip of the iceberg, right? With what even all the stuff we've talked about so far. I can't wait to see where the next few years take us, because I think there's some exciting things to come.